Alberta Health Services wants all Albertans to live the longest and healthiest life possible. Strategic clinical networks will have a direct impact on patient care by leading us in creating the best performing, publicly funded health system in Canada.
The ultimate benefit that we're getting for our patients is they're getting the best of the best.
And that everyone is going to be receiving the best care possible and as efficiently as possible.
These are the goals of the Bone and Joint Clinical Network. It was developed as a strategy to connect to frontline clinicians across the province. The network will solve problems at the front line and create clinical pathways using the best evidence for the purpose of improving quality of care and outcomes for patients.
Clinical pathways help us to all stay on track with what the expectations are before we come into the hospital, when we're in the hospital, and when we are discharged back in functioning in the community.
I think at the end of the day, patients will experience higher satisfaction. They also will be able to set goals and targets and establish expectations with their care providers, because there is a standard pathway that's been set up based on best practice.
It means understanding, for example, if a patient has had a knee replacement, how much bend they would expect to have in their knee after the operation, how much they should be able to get around, and whether they need crutches or a walker.
We've set different goals for hip fracture patients where we'd like them to be up the first day after their surgery. And ultimately, what we're trying to do is set them up for success so that they can be functionally mobile again.
This is day 2 now, completed, so 48 hours. And I had physio yesterday, I was walking.
It helps us to all work together in achieving the same goals for that patient to be mobile and to have less pain and to be able to do the things that they need to do to get back to the activities that they enjoy.
Clinical pathways will benefit patients across the province, and for rural patients we hope that they will also receive the same level of care.
Some of the other things that we look at as a clinical network, and some of the great things about working together is that we're spreading some really good ideas and good care strategies from some of those unique learnings.
The reaction of working with colleagues around the province on the clinical network has been definitely, there's a lot of energy and excitement around developing a clinical pathway, implementing it, getting feedback from staff, and really connecting frontline providers, the management staff, and also patients.
It's an exciting time to work together as a province to achieve exactly what we need to get our patients accessing the care that they need when they need it and at the right time.
And we found that working together in multidisciplinary teams, not only within a site or a unit, but also across the province, has really helped to share ideas and spread best practice in a way that really comes from the ground up.